kynhun jong DKMS BMST Foundation India mynta sngi phang Tarik Nailur kalapulong da program ban jingpynshai halor phang ban khot ban weri nongshong shnong ban shimbynta ban iarap pynioh jingkoit kito kiba jingpang blood cancer ne jingpang cancer snam Lyngba kini program kabala pelong hapoh conference hall jong skul ba University of Science and Technology Meghalaya USTM na kalyang kibor ke DKMS BMST Foundation India kila jing tip halor kilat ban register ki kerteng jong kitu ki bodon kamon ban mi syakmat kum kita ki nong Synñiang kilat jing Pynkoit lani ki potential stem cell transplant donors kabari ka we kalat jing sumari jing pang cancer snam but kiwe ki jingpang snam ka bakenrei bha ki khulung khna apo ka perthai barok kawe kini ka sngi lawan ban sakhilang do vice chancellor ka USTM professor Dr. Gori Sharma Patrick Paul CEO ka DKMS BMST Foundation India Dr. Minerva Mary head of department donor request management ka DKMS BMST na Bangalore lembat kiwe Habakren kini ka program Patrick Paul CEO ka DKMS BMST Foundation India ulay thuo baha North East ka DKMS BMST kalayo ban register kumba 9,000 potential stem cell donors kaba khatsan spa kiday na Assam bat chispa anyaw pau na kajala Meghalaya Henry Lakadopan batang kini kampat la satiaban kot ikajingdon kam ban pynioh ikajing sumar ya gitu gibron kam namar de paulak ngut kidang up kmi linti ban yo ikajing ade bat kasnam kabikidon kam suitable stem cell donor Nakalyang Professor Dr. Gori Sharma, Vice Chancellor ke USTM, ulapin pa bukum kaway ni skul ba apo Meghalaya, kadap da kajingkmen banis nok tilang bat ka DKMS BMST Foundation India, nakabentaban penmi ikita ke shipay ban no Synñiang ban yakun ni Jingpang Bampong, snam, da kaba in penmi ikisamla puli ki ban no Synñiang kum Pynkoit ikinongpang Bampong, kibaya ha bat snam jung kisamla puli kibaladep ban register.
Now I would
There was a poster, Donate and Save Life, which really inspired me to go ahead and register because my mother was initially diagnosed with first stage cancer, so I can really feel the pain that one goes through. So it really motivated me to go ahead and register as a potential stem cell donor.
ওপরওয়ালার ধন্যবাদ যে আমরা এক বছরের মধ্যেই আমরা আনরিলেটেড ডোনার 10-on-10 ম্যাচটা পেয়ে গেলাম
After 1.5 years later, I received a call from DKMS BMST saying that you found to be a potential match for a patient. I was really glad at that moment because not everyone gets this chance of saving life.
এর জন্য যে DKMS BMST সংস্থাকেও ধন্যবাদ জানাই
If I get chance, I will definitely donate once again, and I will strongly encourage each and everyone to come forward and register as a potential stem cell donor.
The belief that each and every one of us has the power to make a profound difference for someone who is really suffering from this kind of almost a deadly disease. And this process is quite simple. You have to register yourself as a donor and wait for someone to be a match. And what inspired me initially was in my studying time. I was in college and there was some events happening there and about the dreadful disease and all, and I did some research and all what are the possibilities of curing this deadly disease, and fortunately I known about DKMS BMST through an advertisement and their campaign drives which happens all over India, and I registered myself as a donor through online process, and after that after I guess I registered myself on year 2021, and after a year I got a match with a little girl who was really suffering from this disease. So
we should also have such kind of the collaboration, because our university has important our work and also committed to the social welfare, social scheme and outreach programs, especially near to our university, the villages, and also those who are studying here. If there is any opportunity for outreach program, our university through NSS takes a number of programs. So I am really thankful that today we have just listened Dr. Minorva Mary giving in short about the stem cells, what are the stem cells, why only stem cell theory. As you may be aware, that different types of treatments are done for any disease. Earlier to 1981, this stem cell was not known, because the blood which was having this inability to produce the blood, which we call blood cancer or leukemia, was treated by irradiation. As we all know that irradiation or chemical therapy are the common methods for treating blood.
Cancer and blood disorder like thalassemia, aplastic anemia, give them a second chance at life. And there is a difference between the communication we do with regards to why people should register as a stem cell donor, and the sir mentioned about umbilical cord collecting stem cell. There's a difference, because we cater to a different kind of stem cell which will help, eventually become blood cell, which will help the blood cancer and blood disorder patients. We have been registering people, doing awareness in different parts of the country since 2019 here in India, but globally we started in 1991. But from 2019 to 2024, in last 5 years, we have registered only 140,000 potential donors. It looks like it's not a huge number, but if you want to make a change, there's a lot of mindset change and everything required, because people are not aware about this, the whole subject, that while you are alive, you can actually save somebody's life. And our objective is to talk about this. There's a lot of myths and misconception also regarding this. So we, as a donor recruitment team or Minerva's team from marketing and communication, we try to actually break those myths and misconceptions and want to talk about